Hello, my name is John Klibanoff, and I'm an orthopedic surgeon at Orthopaedic Associates of Rochester. I'd like to share with you today a little bit about our philosophy and how we care with patients, show you an example of how we apply technology to knee replacement and hip replacement, and then give you another example of how we try to utilize topical literature for the best for your health care. We really view ourselves as stewards for your health and wellness. It is important for us to understand what your expectations are, what your lifestyle is like, and what it is that you need to be able to do after you've recovered from your injury or condition. It's our job as your physicians to then integrate all of our knowledge and the advances in technology to try and speed you to that outcome and allow you to have the best result. Think about technology for a minute. We now have in our cell phones more computing power than they had in the entire program to send men to the moon. We can take advantage of those types of advances when we're planning surgical procedures. For example, when I have a patient who needs a knee replacement, I have them go for a measurement scan before surgery. The three-dimensional computer images now show up on my laptop screen and allows me to manipulate, spin, move the implants in and out of position, and so I can precisely put where I want the implant that you're going to get and anticipate the types of problems we may encounter during the surgical procedure. The technology allows us to look at the original bone, the anticipated resections in color, and then the ultimate placement of the implant. And from this, we create sterile, three-dimensional jigs that allow us to precisely position the implant when you come to surgery. This was something that was not possible 10 years ago. It minimizes the surgical time, it optimizes the outcome, and it ensures predictability so that you know you're getting the best care with the least possible risk. Another example of the application of technology is in planning for certain types of hip replacements. Hip replacement has been around for 35 to 40 years, and unfortunately, occasionally a hip replacement will need to be revised or redone for various causes. At Orthopaedic Associates, we'll utilize some of the advanced imaging technologies to look at what your body will look like once the implant has been removed. Otherwise, we'd have to do it during the procedure, wasting unnecessary time and exposing you to risk. On the wall behind me are several photographs that are taken of three-dimensional images from a patient who needs to undergo a revision hip replacement. In the situation where these three pictures now show us the patient who has a hip replacement that has become loose, we colorize in blue and pink the current implants. What we now seek to do is to anticipate what the anatomy will look like once the implants are removed from the patient at the time of the operation. This central picture is exactly that. It shows us what I will be looking at once the pink and blue implants are actually physically removed at the time of the operation. This type of picture allows me to anticipate where the deficiencies of the bone stock are and what I will need to do in order to perform a successful revision replacement. All of this is done before the patient ever comes into the operating room and is at no risk whatsoever. In and of itself, that's tremendously helpful. What we can also do, and taking it to the next stage, this is a model that can be constructed from that same CAT scan. The model shows us the deficits in the bone that we saw in the pictures earlier. There's a central deficit, there's a deficit in the bone towards the front, and this shows us what we will encounter once the previously placed implants have been removed at the time of surgery. This not only allows me to anticipate where I'm going to need to concentrate my surgical efforts, but it also allows me to pre-construct a customized implant that will accommodate and allow us to put in a new hip socket in the appropriate position, but one that is appropriately shaped and designed to stabilize the implant against the pelvis and to account for the deficiencies that we saw from the imaging studies that we had obtained on the patient. It allows us to avoid the planning on the fly technology that we used to have to implement for that type of procedure. By avoiding having to think on the run, so to speak, we can really advance your ability to recover with predictable outcomes. Finally, I'd like to talk to you about what are considered evidence-based medicine practices. As healthcare has advanced, and in the current climate, especially in this country, the demands on healthcare are to really show that what we're going to do, how we're going to treat you, has evidence behind it, that it's not anecdotally based. For example, I don't want to approach a patient and say, I'm having you do this treatment just because 3 or 4 of my previous patients did pretty well. I want to be able to answer the question of, is this going to work, doctor, with, well, in a study of 15,000 patients over the past 10 years, we know that the outcome to expect is this or that, and that it will be appropriate for you. Evidence-based medicine requires a commitment on the part of your physician. The onus is on us to read medical literature, to pay attention to changes that are occurring. For example, there was a recent study that was well publicized in the news media that arthroscopic surgery, a routine, minimally invasive procedure that many people have undergone, is probably not beneficial to patients who suffer from arthritis of the knee. This is something that we may have suspected before, but we now know if you come to me and you have a problem in the knee that appears to be arthritically related, I'm not going to offer you a procedure that I can show isn't going to be of benefit. I don't have to rely upon, well, that worked for my grandfather, or, well, that worked for my previous patient. I can tell you with assuredness what you're going to get is a proven type of treatment. If you found that any of this information was helpful, or if you have further questions, please feel free to reference our website, www.rochesterortho.com. Or if you have questions that you prefer to have answered on a one-to-one basis, call our general number. It's 585-723-3000. At Orthopaedic Associates of Rochester, we are always looking forward to talking to you, and we're there if you need us. Thank you.